Good morning, dear colleagues. So we shall start our session. As Raminta told, it's already 10:20 and we can start our session. I'm very glad to see you all here and to welcome you to our session. Our session is called Advancing People-Centered Model of Care Through Partnerships. And the facilitators of the given session are Tatiana Nikitina. This is me. I'm the director of the Republican Information Education Center in Uzbekistan. And we will lead this session with the vice director of this center, Shahnoza Azamova. All the organizational issues were voiced by Raminta, but I will remind you that you have a button with the globe and you can choose the language which is more suitable for you. And also all the presentations published on the internet and you can download them. So the first report will be given by Dr. Panagul Mizerbekova, and the report is called Involvement of Partners to Improve TB Case Detection in the Republic of Kazakhstan. Panagul, the floor is yours.
Мы не слышим пока на экране.
We cannot hear the report. We can see only the slide. I think Panagul needs technical support. I switched on my mic, but I don't have anything on my screen, either presentation or sound. So now we have the slides, so we can start probably. The presentation is on the screen.
Okay. Секундочку.
Just a moment.
Нагуль, у нас ничего не происходит.
Panagul, we don't hear you. Nothing happens, so
Видим только первый слайд.
we can just see the first slide, but there is no sound.
Татьяна, секундочку, мы ждем подключения Панагуль Манер. Сейчас ее подключат. И так, все докладчики, остальные докладчики у нас здесь. Доктор Сафаев, Парвана.
So Panagul is being connected and all the other reporters are here with us.
Здесь.
Есть предложение
So
начать.
we have a proposal to start with the second report until we are waiting for Panagul. And then we will continue with Panagul. It will be logical. So I would like to give the floor to Dr. Hassan Safayev from Uzbekistan, and his report is called Implementation into Practice of the latest guidelines by WHO on treatment of drug-resistant TB in Uzbekistan. Thank you, Tatiana Sergeyevna. Good morning, dear colleagues. So let me present my report. So Hassan has already started.
С вашего сопредседателя и первого докладчика.
So will you please present your co-chair and the first reporter?
Здравствуйте.
Good afternoon. Do you hear me?
Нет, это Шахноза.
Shahnazar. So I have already introduced you that you will be my co-chair, Shahnoza Azamova. So we hear you. So I have already introduced Shahnoza Azamova, who is the Vice Director of the Republican Center of Population Protection from TB from Tajikistan. And we decided to start with the second report, but now we have Panagul connected, and probably we can start with the first presentation by Panagul. I will introduce once again Panagul Josebekova, and her report is involvement of partners to improve TB case detection in the Republic of Kazakhstan. Welcome, dear colleagues. Thank you, Tatiana. Thank you for the possibility to present my report that concerns the partnership in TB case detection in Kazakhstan. The next slide. So partners, I mean a non-governmental organization, because we have international partners, it's Global Fund and other international organizations. But in my report, I will touch upon partners, non-governmental organizations. So we have started it in 2012 when we planned the integrated plan on fighting TB. for 2014-2020, and one of the chapters was involvement of civil society in the TB response. We had a lot of tasks, and one of the tasks was to create the conditions for sustainable financing of NGOs. We did not have it before in Kazakhstan because NGOs were mostly working in HIV sphere and not in TB. So we aimed at providing them with financial support and social contracting.
Работа была проделана.
So this work has been done, and at present we can work with the support of the Global Fund, and it is supporting several NGOs. And also we have several grants that are allocated for TB measures. Now we are preparing a new strategic plan for 2022-2026, and we also have a lot of measures that are related to NGOs and civil societies for enable them to get social contracts. And also we have the initiative to enter TB in several cities, which is called Zero TB Cities.
Значит, почему именно неправительственные
So
организации?
why NGOs are involved in TB response measures? Because NGOs are involved in TB case detection, control, and treatment in key population groups, because medical staff has a limited access to those groups. But the outreach workers from NGO, they are trained, they can access these key groups, and they know the needs of these key groups. We also involve in this work people who were treated from TB, those who were affected by TB and HIV. And we have the work which is based on the principle peer-to-peer. And from our experience, we can say that there is more confidence on the part of the key groups to peer and outreach workers than to medical staff. Therefore, we involve NGOs in our work. Now in Kazakhstan, we have NGOs in all 19 regions, and mostly the financing is provided by Global Fund, and in 4 regions we have funding from the local budget. You see that in 2017 we had only 10 regions, but now we have almost all regions covered by the support of NGOs. So the key groups with whom NGOs work are people living with HIV, people who consume drugs, alcohol, homeless people, ex-prisoners and prisoners, migrants, and poor people. These are the key population groups with whom NGOs work. So all of them are called non-governmental organizations. So what are the objectives of the program for small grants? The first task is to develop the interaction mechanism with TB services, with primary health care, with a penitentiary system, with Department of Internal Affairs, AIDS Center, and NGOs. The second task is to actively find people from key groups with TB symptoms to refer them to primary health care and to follow them up. The third task is to facilitate the organization of psychological and social support
Right.
for patients with TB, DRTB, with key groups. And also the fourth task is to work
И тебе, ВИЧ.
and
Пожалуйста,
support
следующий.
the adherence to diagnostics and treatment. So now
Даем за 2020 год.
we have the information for 2020. And I can say that NGOs have started their active work earlier. And since we had COVID epidemics, they have suspended their work for a while. So this is the figures for 2020. And we can say that the figure that concerns informing about TB, it's not quite a big, but still this figure denotes lives of people. This year, within 9 months, we have informed more than 60,000 people about the symptoms of TB, about prevention measures, and out of them, we have selected 13% last year and 15% this year with symptoms, and we referred them to the primary health care. And after that, more than half of them underwent diagnostics with GeneXpert. So we can say that medical staff are able to see the symptoms of TB. And out of those who were diagnosed by GeneXpert, we have identified 335 cases in last year and 546 cases this year with active TB. It means 5% last year and 11% this year. You can see that the active case detection figure increased twice. Also, with the help of non-governmental organizations, we have examined contact persons for TB, and there were no cases of TB within contact persons. So it involves great value because these are people from key groups where medical staff has a limited access. And I think this is a great contribution in TB detection measures. Apart from measures on TB detection, we also have measures that consider treatment support. What do we mean contribution to treatment support? We mean that they follow up people from key groups and they refer them to the places where they have controlled treatment, or they can meet these patients from key groups at certain places where they can get their treatment. So here you see the information for the third quarter of 2020 and third quarter of 2021. We have target indicators in NGOs, and in 2020, they reached the percentage of 99. And you see that in 2021, more people are informed about TB, like 101%, and they were referred to primary health care. And you also can see that the detection of TB cases also has increased. Last year, we had 104 people detected, and this year it's 200 people. That means that outreach workers can identify the cases of TB in key groups.
Эти тренинги
And
либо на республиканском
I can
уровне,
say also that
мониторинговых визитов, когда посещающие
these trainings are provided
так называемые тренинги на
by
местах проводятся. Пожалуйста, следующий.
NGOs and at their workplace.
То, что я говорила,
And what else?
на лечении пациентов из ключевой группы населения.
I referred to the support of patients that are on treatment from key groups. So we mean here patients who break the regimes. So they are referred to NGOs and they are follow such patients. So you see that the percentage is rather high. We have many people that are potential breakers of regimen and they are followed up. NGOs also help us to find those lost to follow up people. And this year, 75% of those people were returned back to treatment. Therefore, such work contributes to the fact that the effectiveness of treatment overall in the country is increasing. If last year we had 309 people lost to follow up, this year we have this figure 151, which decreased. So thank you for attention. If you have any questions, I will answer them.
Большое спасибо за ваш доклад.
Thank you so much for your report.
Я думаю, что с самого первого
I think that the very first report underlines the efficiency of the interaction between the state and the non-state structures and also underlines the role of the NGOs. And this actually proves our efficiency, our cooperation with the state bodies. And now the floor is given to Shahmoz. Please, the floor is yours. Thank you so much, Panagul. The presentation was quite informative regarding the interaction between governmental and non-governmental sectors. We see that there are some specific results, and this is a great joy to us. I would like to mention that all the participants today should not be shy. Please raise your hands, ask your questions either in chat or orally. In case you have questions during the presentation or regarding the presentations, both to Panagul and to the next speakers. If there are no questions right now, or if you do have questions, you may ask them. As far as I see, there are no questions.
Shahnoza, sorry, just I'll go English. Apologize. How many outreach workers were mobilized in bringing out this result? Sorry if I missed if you said that.
Panagul, пожалуйста.
Panagul, please. Actually, I didn't mention it. In these 19 NGOs, about 10 or 15 outreach workers work. And in general, it's around 150, 200 outreach workers per country. So do you have any other questions? Thank you.
Возникает вопрос.
Then I have a question. Now, Mr. Safar asked a question, and I wondered whether the entire country is covered by the NGO services or just by regions. Actually, the entire country is covered, all the regions, all the oblasts. So in every oblast, we have an NGO. And the main focus is in these cities and in the adjacent districts, but in more remote districts, starting with this year, we organize outreach workers visits, and they will cover the remote districts as well. Thank you, that's great. Dear colleagues, in case you have any other questions, yes, I have a hand raising. Thank you. Panagoulis, thank you so much for the presentation. And thank you for the presentations of the other colleagues in our working group. And I think that in our group, the work is much more interesting than in that other group. But Panagoul, I have a question. I know that Kazakhstan is actually a flagman country, and it has not only innovations, but it implements innovations in its fullest. And you said that you have this service provision model that is present all over the country. And this is great. And I think that where the medical services cannot be present, either physically or just with a good word, then the NGOs can do something great. And my question sounds like that. At the legal level, do you have such a model of contracting NGOs to provide such state services? And could you provide more details regarding the end of the contracting of these social contractors, as we call them? Thank you, Andrei. Yes, the work of the NGOs is legalized, and we have the code on the healthcare system, and there is an article on TB, and there are some articles related to that, and they say that NGOs can and should be involved into the provision of the anti-TB services. This is first. Second, there are three options of contracts for these purposes. So the state primes, grants, and NGOs. So either the ministry department is involved, we have the Ministry of Social Protection or the Ministry of Informatics. So they have a center for the development of civil initiatives that every year announce grants in different directions, not only in the healthcare. That's perfect. And our NGOs actually can apply to these grants. Besides that, in every region, the local public authorities also can provide their own grants based on the local budget, and our NGOs already do have such experience. They participate not only in the activities of the healthcare system, but they can also receive that. Besides that, this year, the president stated that NGOs and civil society should be more actively involved. And due to that, we managed to provide advocacy sessions in all the regions at the level of the first heads of regions. And we provided the information regarding the work within NGOs. And we also said that for the next year, the majority of the regions have promised to issue grants in order not to have any other organizations that would not have any work experience in order to fail in their work. This is why on one hand, we provide advocacy. Besides that, we teach them how to correctly provide a technical TOR or technical specifications. So this year we are present in 4 regions based on grants, but next year these grants will be much more numerous. Thank you. Because the Global Fund actually is minimizing its financing. So this work has to be continued. It has to be a sustainable work. So consultancy meetings have to take place. Thank you, Panagoul and Andrei. And we have some limited time, and all the other questions left we could address in the end. So I would like to ask you in chat the questions, or just note them down, and later you will be able to address them to all our reporters. The next reporter is Dr. Ghassan Safayev. His presentation will be on the implementation of the recent guideline on the treatment of the drug-resistant TB. So Dr. Ghassan is
научно-практической медицинской
represents the Republican Specialized Scientific Practical Medical Center of Physiology and Pulmonology, Uzbekistan. So the floor is yours. Thank you, Sokhnoza. Thank you, colleagues. I would like to welcome you once again, and I would like to present you the experience of Uzbekistan based on the recent WHO recommendations. If you look at the chronology of the use of the new regimes and the drugs, then on the entire country, we started using the schemes to treat drug-resistant TB starting with 2013, but from the beginning of 2000, drug-resistant TB treatments was only in Kazakhstan, in piloting regions of the Republic under the Doctors Without Borders organization, and gradually we started implementing drug-resisting TB treatment, and we provided 24-month regime. And in 2015, we had the first experience of using the new drugs and we would treat the patients with broad drugs resistance. And I remember that these treatment courses were quite a successful experience. And from 2015, we started broadly using the new drugs. And starting with 2018, our country entered the international clinical randomized research on TB practices under the Doctors Without Borders organization. And until now, we are using the treatments with predominate within this regional project. And starting from 2018, within the Challenge TB project, we started implementing the short-term or 9-month treatment courses for the immune TB. So this was a pilot project in the Tashkent Samarkand region. And at the moment the project proved its high success of treatment drug-resistant TB, starting with 2019 and 2020, we started broadly using these schemes. And in 2020, after the issue of the new WHO recommendations, we adapted or we renewed our treatment protocols. And from 2020, we use non-injection treatment schemes for the drug-resistant TB patients. The next slide. Besides that, as of now, we have two operational researches. The first one is MSTR, the short-term non-injection treatment of drug-resistant TB with multi-factor resistance. And this research takes place jointly with the European WHO office with USAID, and it is being implemented in 5 piloting in 9 piloting regions. And because of the COVID situation, we didn't manage to reach the numbers set, but starting from 2021, we ended the enrollment to treatment, and now we provide monitoring and observations on the patients. And starting with 2022, we plan to start implementing the new operational research in order to treat the patients with broad drug resistance TB, and we use BPAL. So we have 60 cases according to the plan, and the research is planned until June 2024, and 12 months will be monitored after the treatment. So in the BPAL regime, we will be working only with the adult population, and MSTR also includes the child cohort. The next slide. As I've already mentioned, in 2020, we renewed our protocol. We updated our protocol. It was approved in 2020 within the COVID pandemics. And we plan to update this protocol in the first quarter of the 2022 year after the new WHO recommendations, and the new protocol will be used in MSTR all over the country. And if at that time we will have great results on BPAL regime, we will have great results, by the way, on a scheme researching TB practices that we also plan to include into the updated recommendations on the treatments of the drug-resistant patient. The next slide, please. And here I would like to mention that we have some regimes, the standard regime, the involvement of drug-resistant TB, and actually it fits to the standard 20-month regime and the MSTR regime. This is why when we started implementing MSTR, we had twice an easier and pleasant work, because those drugs that we ordered via the Global Fund program or using the state budget, we had no issues in order to ensure the second level preparations or drugs for MSTR. And when we implemented the new regimes recommended by the WHO, they were the same with the MSTR regime, which also pushed the implementation of the short treatment schemes. Looking at the dynamics of the financing of the anti-TB drugs, we can see that starting from 2020, we see that the state, in a stable way, starts issuing the finance for anti-TB drugs, and now we have 100% coverage of the needs of the first level drugs. And for the second level, we have an expectation of 20%, an addition of 20% of financing. And we see that both the state and the Global Fund are quite open for financing, and we can always include the cohorts for operational studies. For instance, on the BPAL, we can use the grant funds of the Global Fund, and the state money can be used. And besides that, we can reflect these cohorts in order to identify the needs. The next slide. And today we have only 7 drugs registered out of the 23 existing, if I'm not mistaken. So we are using different varieties. And here you can see only the 7 registered. And what is nice to see, this year we managed to register the cycloserine drug. It uses a new CRP mechanism. It has an increased registration mechanism, so it's cheaper, and the process itself is quite quicker. If before that we were able to register them either during 6 months or 1 year, now it is, well, this period of time shortens 2 or 3, 4 even times. And this allows us to register all the drugs that are going to be purchased using a state budget. And we hope that we'll be able to implement that. And in the very end, I would like to say that we will continue working on the national level in order to register the drugs. And now we have full files for the preparations for the first level. Then we have oclosamine. And besides that, next year we plan to update our national protocols based on the renewed or updated WHO recommendations on the inclusion of the countrywide anesthesia regime to treat the drug-resistant TB patients. And also we plan to implement anesthesia. And before the update of the protocols, we will continue our operational studies. That's it. Thank you so much for your attention.
Thank you very much, Hassan. Dear colleagues, if you have any questions, you can ask them. Your presentation was very informative and you touched upon very important questions. I think, colleagues, that we can ask questions. We have a short period of time for 2 or 3 questions. And afterwards, we will continue with the next report. I don't see hands raised. So everything is crystal clear for Uzbekistan? If yes, I would like to give the floor to Parvana Valieva, the chair of the Public Union Saglam Khidmat, and she will present us the report Mobile Application One Impact, the value of community-led monitoring. We have heard a lot about these mobile applications during this conference, and it will be great to hear about it in detail.
Thank you for this opportunity to share with you our TB-REP project results. As Azerbaijan did a very good job within the last 6 years in the frame of TB-REP program in Azerbaijan. I prefer today to present in English. Sorry for the language barrier. Our project CLM, it is community-led monitoring system, is One Impact, called One Impact Azerbaijan. This tool was developed by the Stop TB Partnership and adjusted to the country level within the TB-REP project, which funded by the Global Fund. I'm the project coordinator of the project that is called Implementing and Adjusting One Impact Tool to the country level. The main goal of adjusting and implementing this tool to the country level were enhancing people-centered approach to TB in the country level, strengthen community data and management systems, as well as monitoring and evaluation of the patient social problems, improving access to and quality of TB services, and strengthen collaboration between national TB program and the civil society organization in monitoring evaluation system. The results achieved today, our project, our CLM tool covers 25 regions in Azerbaijan where TB patients download this app and use it actively. The number of users up to date is 1,500, and the number of reported cases until today, 265. The main declined cases are, as you see, 57, are mainly tested and repeated cases. Up to date, we have only 1 open case that's waiting for resolve. Despite the pandemic, Azerbaijan TB NGO Coalition started promotion of the app in 2020, traveling to different regions to promote this app among people with TB. The top barriers you can see here, the chart. Out of 265 total reported cases, there are 194 people who face incurred cases, costs, catastrophic costs during the treatment. That is mainly related to food support, rent and utility costs for their house, and other economic challenges that also affected the treatment outcomes. The second main problem expressed is related to not to access to TB supportive services, mainly psychological consultation and other state social allowances. The results of the One Impact used for policy change. How? This app created a proof-based information system and it created a demand for building a new relationships with governmental organizations and with policy changers, policy makers. Good collaboration with the Ministry of Labor and Social Protection achieved on resolving disability allowance related problems. We are collaborating with Towards TB Free Future organization, which is patient organization, and have a memorandum of understanding with the Ministry of Labor and Social Protection. They are also our response team members. So we tried a lot of ways, and this memorandum of understandings with this organization resolved many state social allowance cases. Migrant TB patients got a right to apply for state social allowances for disability. They have some problem with their ID cards, and it was solved. Amendment to the national TB law was initiated by Azerbaijan TB NGO coalition members in order to get more social support for TB patients. Between 2020 and between the last 2 years, 7 TB patients who reported their problems related to disability barriers got their 5 years of allowances. We have a lot of case studies on this. And finally, in these days, we as NGO, Saglamlıga Khidmat Public Union, we signed a memorandum of understanding with National TB Program, with Research Institute of Lung Diseases on continuous collaboration in TB response in ending TB until 2030 in order to achieve the targets of UNHLM declaration. And we as NGO, within the last 3 years, strengthened cooperation with National TB Program in also screening of TB patients, of household contacts, as well as organization of home care to invalid TB patients who are not able to go to for their routine examinations. And the healthcare workers also helped to us. We educated, we trained them on One Impact usage. Nurses in DOT centers are involved in promotion of One Impact among the patients, as well as we distributed a lot of educational materials to the DOT supporters. So we also had capacity building trainings on mental health to healthcare workers for provision of psychological support to TB patients who suffer from self-stigma. Special thanks go to here to National TB Program, as well as to Research Institute of Lung Diseases and Azerbaijan Ministry of Health to provide special support to civil society organizations through these years of TB REP. Lessons learned. CLM tool gives an opportunity to remotely help the patients and remotely communicate, online communicate with them. as it is mobile app, and it is very accessible from different smartphones. As the patients themselves promoted this app among their peers, that also increased cases reported. The quarterly or semi-annually generated reports, information were presented to decision makers, the mainly social protection ministry, in the way to resolve the problems getting disability allowance. The next step we plan in 2022 and beyond, continue advocacy to improve domestic financing for community-based TB services, to transfer One Impact to a local service and continue our work with it, continue training of the people with TB while implementing other TB projects, while traveling to different places, different regions, and advocating to achieve social contracting mechanisms. As you know, social contracting mechanism is promoted for a way more domestic financing for civil society organizations. And this issue was promoted during the national dialogue conducted in Azerbaijan in 2019. So at that time, CSOs decided to include this into our advocacy plan and national TB strategic plan. So this provides new, this can provide new opportunities for civil society organizations to increase domestic financial resources in the country level. Thank you so much for your attention. It was an honor for me to present our results, our achievements, and it's also honor and pleasure for me today to present our activities, our achievements from Azerbaijan with our honored parliamentarian from Health Committee, Sadagat Valieva. Thank you so much.
Большое спасибо, Парвана. Я думаю, что...
Thank you very much, Parvana. I think that this application will be a good tool for implementing biomedical approach to TB treatment, and also you can have a feedback from patients and then implement more actively psychological and social services related to TB. I think that the questions could be asked at the end of the session. We will have a special time dedicated to discussions. Now I would like to give the floor to the fourth reporter, Ms. Sagahat Valieva. She is in charge of TB caucus in Azerbaijan. Ms. Valieva, please, the floor is yours. So we cannot hear you. Thank you, Tatiana. Dear ladies and gentlemen, dear participants of this event, I would like to say that TB is widely spread in many countries, and due to good treatment results and diagnostics, the trend is decreasing, but still we have a very bad situation. In Azerbaijan, as in all over the world, TB is of high burden. And on May 2nd, 2000, we have adopted the law in Azerbaijan on TB, and according to this law, TB patients have all the rights that are provided by the Constitution. And also in 2015, we admitted that this law is the basic law that is amended very often. We have amended it more than 15 times, trying to improve the legislation in the domain of TB. There were wide discussions that included international organizations, civil society organizations, and in 2018, when we were celebrating World TB Day, we had some more discussions that included international collaboration in TB domain. First of all, we mean here collaboration with WHO. The WHO office was opened in Azerbaijan in 2014, and it aimed to provide good quality services in Azerbaijan. Also, there is a great role of the current government in promoting this activity. We have regular meetings with her at the Parliament of Azerbaijan. I would like to mention that a great contribution in collaboration with WHO was the meeting with Dr. Hans Kluge and meeting with the special ambassador, Michel Kazachkin, in 2019. One more achievement in fighting with TB is the document we have signed, the document signed by the president of Azerbaijan in the domain of TB. Based on this document, we have elaborated the national program on TB, which is implemented since 2020 until today. We have strengthened the material and technical support in the Republic. We have created special reference laboratories in the country. And we have organized special TB rooms for DOTS and hospitals for drug-resistant tuberculosis. In our Republic, we have DOT rooms, and I personally took part in their creation. Also, our specialists participated in many conferences and symposiums at the international level. We also have a special center under the Ministry of Justice, and it is called Center of WHO Collaboration in the Penitentiary System. Now we have a wide network of institutions on TB control, which is under the Ministry of Health of our Republic. We also have a program of directly observed treatment all over the country. We analyze statistical data that refer to epidemiological situation with TB. And we can say that we have a trend to the decrease of the incidence of TB, which says about high level of organization of TB services. At the moment, we have a national program on TB prevention and control, which is aimed to the decrease of cases of TB in the country. And it involves cooperation between almost all the institutions that are involved in this fight. But still, we have to improve a lot in our work, and we have to train our staff, and therefore the government will continue the work in elimination of stigma and providing support of TB patients. And I would like to use the moment, we have 9 days left till the new year. I wish you a happy new year and good health. Thank you for attention.
Спасибо большое, госпожа Садыхат. Было очень интересно предоставлена информация с вашей стороны, и мы очень рады, что
Thank you so much for such an interesting information, and we are so happy that the Azerbaijan Republic has such a great progress and such achievements, and with DBREP's support, everything was possible. Now I would like to give the floor to the next speaker, Valentina Vilk. So she represents the Institute of Physiognomology, Moldova, and she will speak about innovative approaches of people-centered model of care, video-supported treatment. So, Mrs. Valentina, the floor is yours. I would like to welcome you, dear colleagues. Today, my presentation will have 3-in-1. We will speak about innovative approaches, and we'll speak about people-oriented models, and again we will speak about cooperation, about partnership, and about the national program with NGOs. And my presentation is not a long one. I will try to be as brief as possible, and I will present the main points. And today I would like to provide you one of the examples when there is quite a strong cooperation of the NGOs with the national program, and as a result, we have these great achievements that we have today, and we will provide them to you. We will speak about video-supported treatment of TB patients in Moldova. From the very moment when this VST appeared, we had some experience of a VST, and I would like to tell you about the Basa Center, the national program. Again, we have the Department for Coordination of the National TB Control Program. It all started in 2015-2016, when for the first time it was called VOT treatment in Chisinau municipality. And this is actually the capital of the Republic of Moldova. So we've seen great results, and there was great experience both from the physiatricians, and when we compared the quantitative assessment, we saw that the results of the patients were great, and in 2016 we developed guidelines for VST treatment, and we are happy for the PASA Center support, because in the current context and in the COVID pandemic, so the support is quite important. And in 2019, we revised and approved at the Ministry of Health the organization approach of VST, and the medical staff, physiopulmonologists and the nurses, they are practically ready, and the VST platform is ready from June 2019. And there was one small challenge: the system had to be registered in the National Center for Personal Data Protection, and this was a little bit extended, and the situation worsened because of the COVID-19 pandemic. But in 2020, we all actually went through these first steps when we were deciding what to do, how to move forward, and we understood that the identification of TB would suffer a lot because of the pandemics, and we had some limitations for movement, and the entire network had to be reoriented to another disease, COVID-19 disease. So you understand that the entire health system was reoriented, and we understood that there were lots of gaps. And this was one of the moments that quite quickly allowed us to receive support from the Ministry of Health in Chisinau, and then the support spread quite quickly to the entire republic. And the moment there was offer, demand appeared as well, and we started providing our services all over the country, and then people started addressing us more and more, and then we continued providing treatment under the supervision of the doctors, but not physically, but using the VST. And it's great that we also have foreseen the implementation of the VST throughout Moldova, and this allowed us to reach the following results. And we switch to the next slide. So how VST is organized? You already know that from the previous conferences. We showed them our experience, and when everything started in 2018, 2015 even, everyone thought that it was rocket science and practically impossible. But now, being in 2021, we understand that everything is quite easy, and it's patient-friendly and doctors-friendly, and we know now through the system what happens to the patient. The patient can anytime address the physiatrician or a nurse, and you can see how everything takes place. So basically, the patient is being informed about the possibility of undergoing VST treatment, and posters are ready. We do not kind of advertise VST, but we provide information so the patients already know from other people that there is such a service, and then the doctors confirm that there is such a service, and the nurses too, and the patients say that yes, we would like to take part in the VST, and then they are connected, they have to create their accounts, and then there is a video of taking medication, and the nurse releases medications to the patients for 2 weeks, and the doctor fills out the patient profile with information about the treatment regimen, and the doctor nurse watches the video and evaluates the pulse of medicine intake, and there is feedback. And it's quite important that the feedback is received by the patient. So this is to support the patient, and in case of some adverse reactions, the doctor can encourage the patient or tell them what the next steps will look like. So we switch to the next slide. And as of today, all the doctors and the nurses, pulmonologists, physiologists, they had online retrainings. And in 2020, taking into account the current situation, we had to quite quickly implement VST all over Moldova, and we switched to online training. And I would say that this was quite a great cooperation or partnership between the PAS Center, the National Center on TB Control, and The necessary IT equipment was distributed and delivered to the doctors in 55 healthcare facilities and 350 patients. And now more than 350 patients went through the VCT experience. And the slide in the lower part shows the treatment success rate. And you can see that the success rate increased respectively. So we started basically from the 2020, and now in 2021 we have 100 coverage, geographical coverage with VST, and the services accessible both for the left and right riverbanks. We should not forget about Transnistria. So VST is a huge success to our program in the Transnistrian region as well. Practically, I would say that it's a 3-in-1 example. This is a great example of great cooperation, of great results dissemination when the national programs can cooperate with NGOs. And in order not to speak in vain, in order you to believe that VST was accepted both by the doctors and by the patients, probably the next slides will be pleasant to you, where you will be able to hear the opinions of our patients and doctors about VST. I welcome the VST. I am so happy that I can see the patient every day. Every day I can see how he administers drugs, and what's interesting, thus we can see the condition of the patient. Daily visits to doctors were quite a challenge for Elena, but she was ready to undergo that just to get healthy. And she chose VST. It's quite comfortable. I don't have to go anywhere. Now, due to these pandemics, VST is quite handy. It's easier. In hospitals and clinics, there are huge lines, but now you just go there, you take the drugs, and you do not contact with anyone else. You just make a video and you send it. So this is one thing, but there is another thing. After the administration of the pills, it's not quite a nice feeling, you know? And in this case, you at home, you do not have to go anywhere else. Now Elena has much more time to spend with her child, and she feels safe because she should not stay in the queues in hospitals or medical institutions. Probably these two short videos that you've seen on Facebook, they can speak much more compared to my entire presentation and compared to all the figures you've seen. What are our further plans? So speaking about sustainability, basically, we worked within To Be Rich and within the Global Fund program, and now we have to make sure that one moment we are able to deal with the situation by ourselves. And of course, there will be some other steps, and there will appear some questions, there will be some challenges, and some trainings will be needed. This is why we speak about sustainability. The entry in the unified medical records, well, this is one of the issues. We have the informational system to monitor people with TB. It's quite a great system. Well, it needs some updates. It needs to be developed even more, but this is a great database that allows us to assess the epidemiological situation in the Republic of Moldova, practically at the level of every village. And now there is a tendency in Moldova that there will be the unified medical record, the registry that will join all the databases, because now The primary healthcare has its own database. The hospital care has its own database, and so on. And we probably will once have one single unified medical registry. And at least one of our goals was to register our VST database and also to introduce it into the unified medical registry. The regulations revision, well, I've already told about them, because upon their implementation, some updates and revisions will be needed, depending on the implementation experience. And I would like to comment on my colleagues from Tajikistan. Uzbekistan is the one who also implements this very platform. And like VCT will probably, it will be a great support to our further cooperation, because they will have some specific questions, they will have some other ideas, and at the moment we start working jointly with them, we will not only have a database, we will not have only an VCT platform, but we will be able to take over the experience from the entire region, not only from our own country. So this is all I wanted to present you. But before I finalize my presentation, I would like to thank every colleague who worked on the implementation of this VCT. I would like to congratulate, first of all, the PASS Center and Christina Cholan, who was our inspiration, and she managed with her insistence to help us quickly implement everything in the Republic of Moldova. And the colleagues also, Sergei Platon and Inna Pushoy, helped us. And let's not forget our national TB coordination program. And I wonder whether we will see each other before the new year, but I would like to thank you all for your support. Thank you so much for your attention, and I wish you all a great Christmas, Happy New Year, and stay happy. And this is where I end my presentation. Thank you. Now, maybe you have any questions, I will be happy to answer. Thank you so much, Valentina. I would like to also thank the Republic of Moldova from my side, because actually we are finalizing the adaptation of this great application I like VCT, and I hope that we will keep in person. There is a person from Turkmenistan, probably. Yes, please. Hello. I do not have quite a question. I would like to say some thank you words. Thank you so much for such a vast presentation. Thank you so much for your activity, because actually you are an example to follow when it comes to the implementation of VST. And I would like to say that with the support of the PASS Center in Turkmenistan, the program for its adaptation was already implemented, and now we are looking for some possibilities to implement actually the server in Turkmenistan. And we hope that some best practice that you use in your work can be disseminated. And thank you so much for your readiness to provide further support in our implementation processes. Besides that, I would like to express my words of gratitude to the PASS Center. Actually, this is a unique project. This project is quite a multilateral one, and it supports both the civil societies and NGOs and the state organizations, state bodies, and they can implement the tasks in order to fight TB. Thank you all. And now I would like to also congratulate you on the Christmas and holidays. Thank you so much. Our session is coming to its logical end, and now I would like to give the floor to the sixth presenter, to Safarlin Naimov. We are so happy to see you, Safar. And his report is called Standardized Packages of Support TB Services at the Community Level. So you're welcome.
Good day, dear colleagues, dear friends. I'm very happy to see you here. Let me thank all the first thank and congratulate all the colleagues for the successful implementation of all this work. This is I myself, I share the sense of pride for having implemented these activities for the benefit of people with tuberculosis and supporting our national TB programs. And many thanks to the prime recipient of the project, PASS Center, for great support and lovely team members that we enjoyed working with during these years. And we hope and wish to continue the same spirit of work. So we did bit of all the works presented by the colleagues in pilot areas, but here I would my presentation will focus on the standardized package of support TB services at the community level. Let's go to the first slide. Here, it's worth mentioning that in Tajikistan we have a good legal framework, and the legislative part is already available. It has been. If I may request to go to the first slide, please. Here we put some of the documents, base documents that existed in the country since 2012, 17 till date, including some of you see listed here. Adopted these resolutions and some approvals from government, from parliament, and also national TB program, the decree on the implementation, monitoring of the national TB program, and strategic documents, including national health strategy of the country. So these were the baseline and the legislative base for what we have done in terms of social contracting. Let's go to the second slide, please. Here, the context of the country, to me, it looks like most of these are relevant to other countries in the region. Including we have reduced donor funding and high demand for social support and great potential of NGOs and lack of adapted mechanism of social order in healthcare, and need to improve the access and quality of medical care for people with TB problems. Next slide, please. And still next one, please. One more. Yes, no, previous. Yes, here, why was the purpose of adaptation and what is included in the standards documents? So based on the national peculiarities, features, we needed to bring some changes into the document while adaptation, and the package was with details, and it was important to make it more compact. And in terms of content, it is conditionally divided into two parts. So the structural standards, and the second part as a guide to implement social order. So, so it includes actually 6 chapters, and with introduction and list of services, description of the standards of each services, minimum functional standards to the competence of service providers, minimum structural standards for social services, The document that we have developed, if I request to next slide, let's move to next slide, please. Yeah, basically it took us 3 stages during the adaptation. Adaptation and approval and final signature, I would say. The first one was a consultation that I must thank our great consultant who's present here, Dr. Marifat, and other colleagues who has initiated the draft, and we shared it through our NGO Google Listserv, collected the feedbacks and comments, and finalized it as a specification and standards of categories of social services. Social support for TB affected individuals and their environment. So that was the name of the document. It was like beginning of 2020. So the document was consulted with civil society organizations and shared with NTP and other key stakeholders. That actually was a time when also the colleagues started engagement, and of course this was already like part of the same vision for all the partners in the country, the need for taking this forward. And with the order of Minister of Health from September 4th, 2020, a thematical working group has been established with leadership of Deputy Minister of Health and with technical support from our colleagues, USAID, Etica in the country, and the NTP, and the colleagues from the consultants who were specialized in social contracting with HIV and other spheres, but also other NGOs that we, the key department heads of the Minister of Health departments were part of the working group. And so here the document was actually established, developed. Basically, it was an opportunity for us as TB affected communities to have in the presence of the key decision makers, the Deputy Minister, to bring the voice of people affected by TB and show that why it is necessary and what are the primary focus of area in this area, and what NGOs can bring for the national TB program. So that document was developed and through several meetings, offline and online and in person, and the classifications and norms of medical and social services and supports for improvement of results of treatment of people with tuberculosis and prevention of tuberculosis. So that's the final name of the document that has been signed just a few days ago on December 17th by our Minister of Health based on an order approving this document that it brought us till date. It has been a difficult period for everyone during COVID, but in spite of this, as necessity, so this is done just prior to moving to 2022. So that's the last slide I had. And the last thing, I just thank all the colleagues again, and just to mention that yes, TB-Rep brought us together as a coalition of Stop TB. We were like newly born association, but with TB-Rep we grew and we gained confidence and knowledge, and we made friends with key decision makers, and we built and strengthened our friendship with our NTP managers, with NTP team and parliamentarians, religious leaders, and celebrities and government. So this journey continues, and we look forward to working together. Thank you again, dear Tatiana and Dr. Shahnoza, the co-chairs and the participants for your attention. Thank you very much.
Спасибо, доктор Сафарали.
Thank you, Dr. Safarali. It was very interesting to hear from you your report, and it's not only me as a representative of Tajikistan, but also for the specialists from other countries who are participating in our online event. So it was the last report for today, presented by Safar Naimov from Stop TB Partnership Tajikistan. Dear participants, dear facilitators, please be very active. You can ask questions to all our reporters, to Dr. Panagul, to Dr. Hassan, to Parvana, to Mrs. Sabekat, to Valentina, to Dr. Safarali. So you can ask your questions and please be active, dear colleagues. While everyone is thinking it over, I would like to say on behalf of the team of Uzbekistan to all the partners who were implementing the project TB-RAP and TB-RAP2, many thanks to Center Pass, because these are highly professional people. Thank you very much for your patience that you revealed to the participants, because at the beginning it was not quite clear and smooth, but anyway, thank you very much for your support. I would like to thank WHO for the support. I would like to thank our national TB program, to the team that is headed by our colleagues. Thank you, colleagues. Happy New Year and wish you good health. Thank you, Tatiana. Dear colleagues. As I see there are no questions, if anyone wants to add something, we still have some time left. I would like to say, as a representative of NTP of Tajikistan, I would like to express my gratitude to Center Pass, to the project TB-RAP, because Tajikistan is working for several years with you, and it was a very fruitful collaboration. And as a result of it, we have achieved a lot of success. And these are all our common success. It refers to people-oriented services, and also support of civil society, implementation of new treatment regimes, implementation of VCT platforms, and One Impact application. We have implemented it as a pilot project. Now we are rolling it up, and we are very grateful to our colleagues from PASS Center that they are actively involving countries from Central Asia, including Tajikistan. And in the period from 2020 to 2021, we have participated in many assessments and analysis concerning gender, community rights. It was very informative and useful. And on behalf of my leadership, my management, and On behalf of the National TB Program, we express our gratitude to you, dear colleagues, and we hope that you will successfully finish this project this year, and in the future, we will continue our collaboration. Thank you. Happy New Year to everyone. I wish you success, health, and achievement of all goals you have. At the end of our session, I would like to give the floor to Liliana Karaulan. She will tell us about the future plans, because everyone is interested whether we will continue our collaboration in the future. Liliana, please, the floor is yours. Thank you very much, Tatiana. Thank you very much, Shahnoza. Thank you to all the reporters. I think we had a very fruitful session with very good examples and progressive experience from all the countries. And I would like to thank all of you, because nothing of what you have listed today would not be possible without your involvement, your knowledge, without your activities and works, and without your prior experience, because without you we are helpless. This is solely your achievement, and I hope that everything that was done within the project TB-RAP and all the information that we will get from the assessments and analysis of TB patient pathway, analysis of barriers that people have in access to treatment, barriers that refer to stigma and discriminations. All this information will become an evidence base that will help countries to get necessary knowledge and to improve the model of care in their countries. We have prospects, but we will speak about them tomorrow, because tomorrow, apart from the summary of our discussions that we had today, we will have a summary of the discussion that we have in another group, and tomorrow we will have a very good agenda. We will have awards, we will have meetings with parliamentaries, and we will hear there what comes next. We will have a session with TB-RAP partners that will share with us what are their plans for the future. So I will not tell about it today. I hope you will be able to participate tomorrow, and we are waiting for you at 8:45 Copenhagen time, according to our agenda. And tomorrow we will have the director of Stop TB Partnership. So welcome to our tomorrow's event, and you will hear what follows after TB-RAP. Thank you very much to all of you. And in case you do not have any questions, you can see the agenda for tomorrow. You can see your colleagues from the countries who will participate in the panel discussion tomorrow. And also, there is a link in the first part of the agenda. It is the same link that you have received initially for being registered at this conference. Thank you very much. See you tomorrow.
Спасибо, до свидания.
Thank you. Goodbye. Have a nice day. Thank you. See you tomorrow. Stay safe.
Всем до свидания.
Спасибо большое, до свидания.